Hello, ma'am. How are you?
Hi, I am doing great. How are you?
I'm grateful, ma'am. I hope
Okay.
this is not a hassle for you right now because
No, not at all. I'm fine. We can
so
go ahead
I,
with it.
yeah, I'll start from my introduction. So I am Palak from Asha Akanksha Foundation, and this is our event Career Talk, and we'll be talking about like how to go ahead with this career, like clinical counseling as a career. So can you please just
Right.
tell us a bit about yourself, ma'am?
Sure. So, my name is Anuna Bordoloi, and I am a consultant clinical psychologist with Fortis Healthcare, Department of Mental Health and Behavioral Sciences. And I have done my MPhil in clinical psychology, and that gives me the license to practice as a clinical psychologist under Rehabilitation Council of India.
And ma'am, the first would be the most common question, like, why did you choose clinical psychology as your career?
Okay, I think it is all about the passion that I had. I remember not knowing much about the field till the time I was in graduation, and since then I somehow have known that I want to be a clinical psychologist, and I have just followed uh, the path that has led me here.
Okay. Ma'am, like every person is different and has different traits, but like, according to you, what is the most important trait that a clinical psychologist should have, like, to be a good, successful one?
Okay, I would like to answer this question in two parts. First, I would say that, to become successful, again, success is something we measure in different, in different terms. Somebody measures success in terms of finance, somebody, in how much you're able to do, somebody measures it in terms of knowledge. But I would say success for any career would be for me, again, I would say passion. If you're passionate about your field, if you want to, if you know what you want to do, and if you know what that field demands, and you are ready to give it all, I think that is one of the most important qualities of choosing any career. And for clinical psychology or any fields in psychology or psychiatry, I believe that we need to know where we are entering, because undoubtedly it is not a very easy career choice, right? You have to deal with many health problems day in and day out. You listen to people, and there are many hurtful stories, and you have to be there at the serving as a professional. So I would say that you need to know that what that in this job demands, and developing yourself accordingly. Like when we have to go through the training process, which which makes us clinical psychologists. I think these are the traits that we are demanded to uh, develop. Like some important traits, I would say that like being genuinely interested in the field, being compassionate enough, and uh, willing to give, willing to help, willing to give how much ever you can, help how much ever you can, to help the person come out of his misery.
Okay, okay, ma'am. Also, I was really curious, like, how has your journey been? Because you started long back, like 6 years ago, you did your MPhil, and psychology was not taken that much importance like it is now. It's been better, but yeah, it was a long time ago. So, how has your journey been?
I would say wonderful. I mean, till now, wherever I have been, however, difficult paths might have been at times, but I have enjoyed it thoroughly. But definitely, I would not say that it has been an easy one, because, like you said, that it was not. that accepted, and we did not know, like, nowadays you type in Google what a clinical psychologist is, you easily get the answer. But at that time, I mean, although the internet was there, Google was definitely there, but it was not that accessible to all of us. And we had to go through researches. We had to know that what are
Hello.
this and get well. Why do we need to go to a psychologist? So all these issues, I think, is there, and it was there maybe with maybe a little more amount. But yes, so if you are passionate about it, if you have that goal set, I think somehow you reach to the destiny.
Okay. So, ma'am, like keeping all the confidentiality, like, can you just share with us a situation like where you thought the work was it was really difficult, like some client or some disorder that you thought was really difficult for you personally?
Okay, if I
Yeah.
speak personally, then I would say that I I mostly enjoy the cases which are not straightforward. I mean, maybe the diagnosis is, but then you have to work on the case, to finding the root causes of the problem. And most of the psychological disorders are like that. That you have a root cause, and then but it is not on the surface, so you have to dig in, and that is what I enjoy most about the profession. So most of my cases are like that. But then difficult, I would say that at times when there is inconsistency of the information, given by the informant and the patient, then I would say that it becomes a little difficult to decide which way to go and whom to trust. And of course, we have so many tools of finding it out. Uh, but yes, so I would say those are the difficult cases. And all other diagnoses, I think, I enjoy the more mysterious it is, the more I enjoy.
Actually, ma'am, when I was going, like reading about you, I saw you were into rehabilitation and the addiction as well. So, like, what made you go towards it? It's not an easy path to choose. Like, so what made you through it?
Okay. See, I would say that it's not that. I mean, these are different careers. Like rehabilitation is also a rehabilitation and drug addiction. The addiction it is also a part of clinical psychology. But in the beginning of the career, you explore, right? You explore many paths. So that was one of them. So I wanted to see that, I wanted to work closely with uh, drug and substance use patients, and I wanted to see that, yeah, how that field works, so that I can understand a little bit more about working in that field. So yes, so that I think that was the reason. It was initial, and I still work with them. So yeah, as a part of the field, that is still
Okay, okay, ma'am. So, there's like a pandemic going on, and our mental health is the first and foremost thing that should be important. But some people have really gone through hard times. So, how do you maintain a healthy lifestyle, like a well balanced life yourself?
right. Am I audible?
Yeah, yeah, yes, ma'am. Yeah.
Okay. Yes. So see, undoubtedly these are difficult times, like you have mentioned. But I would say that these times have also uh, made us learn so many things. It has taught us so many things, like the importance of family, the importance of that support system, and what we can do to nurture ourselves, how to build resilience. I feel that there are so many factors, and I think to continue all these things out. I mean, other than work, I would say that develop a hobby, anything you like, doing. Not necessarily it always has to be your career, isn't it? So if somebody likes gardening, somebody likes cooking, somebody likes reading, whatever you like, just keep some time of the day towards that particular work and towards that particular hobby, and you that would relax you the best. And keeping a strong support system, like keeping time for your loved ones, like just reaching out if that physical visit is not possible. Reach out digitally, talk to them for some time, and spend some time with yourself. I would say that these are some things I would like to say that we need to do during a pandemic like this.
So, I'm talking about the pandemic. So, what would you recommend to the students who are right now like choosing clinical psychology as their career? Like some do's and don'ts for them.
Hmm. Oh, okay. I think this is a difficult one. Uh, well, I would again say that many students, I think, when people come interning with us, or they come in touch with students, that they come in touch with us in any way, they ask about they are worried about the financial part. I would say that if you are here thinking that you are going to make a lot of money, I would say you do not need to come. That I say for all, I mean, any career that you want to choose. If you are best at your job, you do not need to worry about the finances, right? So you need to know whether what is the job demand and why do you want to do it. What is the why do you want to choose this career? Why do you, is it just fancy, everybody is doing it, your friends are doing it, or it is like I said, it is a very fancy career? No, these cannot be sustainable ideas, right? You have to be there. If you're choosing it, you're doing it for the next at least 20-30 years of your life. So
Yes.
I'd say uh, find out what are the job demands and what you want to do, because most of your time, like while you are awake, around 8 to 10 hours, you are going to spend at your job, right? So it is very important that it is your passion. So I would say that find that out, take your time, there is no hurry, and find that out and then go about.
Yes. Thank you, ma'am. Your voice is so inspiring. I'm so yeah. So, lastly, ma'am, my question is like, if you weren't a therapist, what would you be?
Hmm. Okay. Here I would like to add a funny story, because maybe there are a lot like me out there. Uh, my parents, when I was doing my degree, they just wanted to, not my parents, but my family members, they wanted me to explore, the MBA side as well. Actually, during those times, MBA was a hype one that, everybody was going for that. So yeah, so they wanted me to explore that as well. But luckily, I was, luckily or unluckily for them, I was adamant enough that I want to choose this career. So yeah, I think that there will be many hurdles, but then if you want to become what you want, then you would anyway reach there. But yes, if I'm not a clinical psychologist, then I could have been anything. I could have been maybe a chef. I could have been into some service business. Maybe I could have been in some HR job. Who knows, right? But I'm sure that I would have been equally, good at all of them. But definitely, this has been my passion. This has been, something which I always wanted to do. So I'm sure that I am, best at what I have been doing. There's lots to learn. There are many best people, many best, therapists who's out there, and some of them are from the department itself. They constantly keep on inspiring me with their work, with the, kind of work they are doing, with the awareness, kind of awareness that they are creating. So these have always been my inspiration, and I wish to continue developing myself, and we will see
Okay,
where I go.
definitely, ma'am. Thank you. I think we will end this here, but I wanted to tell you that I personally am doing psychology right now, but I'm in my bachelor's. Although I'm more
Okay.
into forensics, but India doesn't
Mhm.
have that much scope for forensics, so I will be choosing clinical as well. So
See, by the time you pass, there is GFSU, Gujarat Forensic, Institute. So they are doing wonderful work in forensic as well. So do not think about it. You explore what you are so passionate about. You explore whatever options you have, and definitely you would be able to be there, whether clinical, whether forensic. If you're passionate about it, I am sure you're going to do well with that.
thank you so much, ma'am. It was a pleasure
Okay.
interacting with you, and thank you so much for your time. Like we are really glad that you did it today. Thank you, ma'am.
It is sweet. Yes. Thank you.
Thank you,
Bye.
ma'am. Bye bye.